And next, I'm going to invite Dr. Micah Weinberg to the podium. He's the president of the Bay Area Council Economic Institute, which, if you're not familiar with it, is a think tank that focuses on regional economic and policy issues. Please, thank you.
Evening, everybody. I'm from the Bay Area, but okay, good. We got some Bay Area people here. But I don't want to lose the audience, so I'll say, like, condolences about the Dodgers. We were all very sorry to see how that went. All right. In any case, I'm considering a career change. And I think I'm going to go into creative writing for children. And the reason is because if I have to spend all my time like thinking and talking and writing about total fantasies, I might as well be writing about elves and dragons, which are much more fun to write about than short-term health insurance and single-payer health care and just a number of different things that are sort of interesting in the abstract, but really are not the sorts of things that represent the direction that we either are going to go or should be going in the United States. And there are kind of a lot of examples of these fantasies in healthcare. So the idea that short-term health insurance plans or association health plans represent anything other than sort of a manifestly failed policy strategy that if anyone ever talks about them as the future of healthcare, they should be, well, it's violent to say slapped in the face, just like, shunned, I guess. But also then beyond that, the idea that we would add $200 billion to our state budget, financed through state taxes to create a state-based single-payer system, is something that's a waste of time to talk about, right? I was advocating for $3 billion to extend Medicaid to undocumented immigrants, and this was at the height of an economic expansion. And that $3 billion price tag in this particular market made that conversation in reality a non-starter, right? So if we can't get $3 billion, we're not going to get $200 billion. We just need to be practical about that. Maybe we think about this happening at the federal level. Again, are we going to add $1.5 trillion to the federal government financed by taxes? Maybe we are, maybe we're not, but we'll see. But actually the truth is that I'm even getting a little bit skeptical about all sorts of other things in healthcare, like a lot of the stronger arguments about price transparency, that price transparency is magically going to hold down healthcare costs. In fact, I've gotten a little bit skeptical, and this forum is taped, but I'm going to say it anyway. I mean, I advocate for like paying for value in healthcare. I'm actually even beginning to wonder whether that's as ephemeral a goal as like bringing dinosaurs back. Just because I've been giving this same talk, right? Not just me, right? Like, we're going to pay for value in healthcare. It's happening. Like, it's not happening yet. It might happen, but it didn't happen the last 10 years that we said it was going to happen, or the last 20 years. Hopefully we're moving in the right direction, but these are really hard things, folks. Like, any individual doctor's practice, any individual hospital is like more complex than you could almost possibly comprehend. Yet we are so utterly confident in these super high level policy proclamations about the way that healthcare should be. So I hope that after, this election, the best thing that'll happen coming out of this election basically is that we will forestall some ridiculously stupid ideas from actually happening, right? So obviously, for all of its faults, I don't think anybody is going to be served by replacing the Affordable Care Act with short-term health insurance plans for everyone, as is the sort of suggestion. And I've got to endorse Professor Kaminsky's the Republicans that are telling you that they are going to be caring for people with pre-existing conditions are just lying to you. If we need to lock arms and be accused of bias there, I'm locking that arm. Because it's just, if you are offered a plan that is prohibitively expensive, that is actually not a solution for you as an individual. So what's at stake in this election? Forestalling some of these horrendous ideas. I would like to apologize to you all on behalf of the state of California for having to weigh in on some of these completely insane propositions that you have. I'm sure that you've all spent a lot of time thinking about how dialysis clinics should be paid by payers, right? Because it makes sense to have y'all think about that, right? It makes sense to get you in the middle of a labor dispute between unions at dialysis clinics and the dialysis clinics themselves. I'm not even going to say who's right? Good for the unions for doing their thing. Good for the dialysis clinics for doing their thing. This is not where we should be having this conversation. You are also going to be asked to weigh in on something I'm sure you're all expert in and really interested in, which is whether or not EMTs should get rest breaks, right? I mean, maybe they should. They should probably get all the rest breaks. I mean, I'm not even saying I have an opinion, but it's not important what my opinion is on this particular issue. This is ridiculous. And the question is, when are we going to get back to a point in the United States and in California when we can have some modesty about how we do healthcare policy? And unfortunately, I don't think it's going to be 2 weeks from now. But maybe we can forestall some of the worst possible outcomes of a week from now, and hopefully with this is not a likely outcome, but I'll end with hope. With Democrats controlling one house and Republicans controlling the other house, maybe they'll see that they have to work together on something. A boy can dream. But most likely, I'm just going to go start writing about dragons and elves.